So a topic I wanted to talk about was toxic environmental risk factors that affect and their effects on ALS patients. This is something important to me, and I've discussed for a couple years now, just with my experience with ALS patients. So my question I decided on was, does exposure to toxic environmental risk factors pose a greater risk to ALS patients with the ALS-linked gene or to those without? And so just briefly, what is ALS? It affects the upper and lower motor neurons, and symptoms usually start with change in voice, slurred speech, extremity weakness, and then it can lead to unable to eat, breathe, and eventually death. So ALS incidence is increasing. For example, in my town of 4,000 people there were 2 individuals who were diagnosed with ALS within just 3 years, and the deterioration of the disease was hard for the community to experience, the patient and the patient's loved ones. So it's extremely important to continue to perform research on ALS to better understand this incurable and debilitating disease. And by getting a better understanding of the disease, hopefully in the near future, we can find better treatment options. And the big concern as we continue to perform research is that ALS patients generally only live 2 to 5 years after they've been diagnosed with ALS. And as we know, research, new drugs, or procedures can take years to get approved or even show any results. And these patients do not have years. As I said, they only live 2 to 5 years after, because the disease advances so quickly. So I want to investigate some prevention methods that could even save just a few lives. And some people may be predisposed to developing ALS, and few researchers have been trying to look at what factors might bring out ALS disease in these individuals. For example, contact sports has been a big one that they've been examining as a potential risk factor. I think it said around like 35% of people with ALS had been involved in contact sports, but this is kind of hard for a parent to want to take their kid out of a game like football for a small chance about getting ALS. So environmental toxins might be related to developing ALS, but we know they might be related to developing other health conditions like cancer, lung cancer, asthma, COPD, and more. So hopefully people might be more likely to listen to warnings about living in certain high toxic environments or working there, especially if there's like a family history of ALS or cancer. And say like a family is looking to move, they might think about these things. So also hopefully some certain areas, governments or companies that are high risk for toxic environmental exposure, they might be known as hot zones, and they will look to be more environmentally friendly. So the gap in research right now that I'm looking at is if these environmental risk factors like pollution actually play a role in developing ALS. Some studies have been done briefly looking at this, but not in great depth. So as mentioned earlier, doing research on ALS is hard since patients only live a few years after their diagnosis, and there aren't too many people with the disease. So many people, getting as many people worldwide as we can for the study is really important. And I think the best way to address it is to test patients with ALS, see if they have the ALS-linked gene if they want, and have them write out like a detailed list of where they've lived, maybe if they have a second home, if they go places frequently, or their occupation. Then researchers can look up these places and see if they're considered hot zones or if they have toxic environmental risk factors and what they are to see if there's a connection. Also, I think it's important to look at if the ALS gene is more related to toxic environmental risk factors or not. But overall, I think this question is measurable by being able to measure if the patient has the ALS gene and exposure to any toxic environmental risk factors. And I think it's ethically sound if the patient agrees to participate and give a detailed history. Practicality wise, it's hard, but it's doable. And I say that due to not many people having ALS and getting a detailed history may be difficult, but I've seen it done. So with those factors in mind, I came up with the research question again, looking at environmental risk factors posing a greater risk to ALS patients. and if they have the ALS gene or not. So thank you.